So in this video we're going to talk about hearing aids, a little bit of history, some of the styles, fitting considerations, and so forth. So early on, you can see that handsome young man there using an ear trumpet, and those are effective. I mean, you can cup your hand around your ear and record what happens at the eardrum, and you get a few dB of increase, but not enough to help much of anything. But that's early on. Then we went on to the electronic hearing aids and carbon hearing aids. Here's some early carbon devices, vacuum tube devices, extremely large in size. Here you have some, this one right here. All these are what they call, all these up here, not these down here, but those are all called body aids. So if anybody's a fan of the Rocky series, anybody remembers Rocky's coach, Mick? Well, he had, if you watch the video and watch close, this is what he had. He had that little knob thing in his ear. So those are body aids. That was pre behind the ear hearing aid. These were the first ones that were developed, probably in the 60s maybe, and then these were more, the in the ears were in like the 80s, before you were born, most of you. Current technology is digital. Analog was the basic technology years ago. Digital is what we use now. You plug them into a computer, you can make a massive amount of changes for lots of different things. Here's all the basic components of a hearing aid. You have a microphone, you have an amplifier, you have what they call an analog to digital converter. That's the A/D. The analog to digital converter basically takes the analog electrical signal from the mic, turns it into a digital signal, which is a bunch of ones and zeros, and then is processed through the DSP, which is the digital signal processor. And then once all the processing is done and the manipulation is done, then it's sent to a digital to analog processor to turn it back into a sound that they can hear. You can't hear digital signals. You need to have an electrical and then an analog signal. Then it goes through the speaker, or the receiver they call it, and they all have a battery to run them. So here's a hearing aid with some components. This right here has microphones. Here you have two microphones. Two microphones are used to help people hear a noise. They're called directional microphones. Almost every hearing aid has at least two microphones to help people hear better in noise. Every hearing aid has an amplifier, and sometimes there's one before the analog to the digital converter, and then there's one after. But an amplifier just basically increases the electrical energy as it passes through. The receiver is the speaker. So you have the battery, the amplifier, the chip. You have the speaker here, which then sends the information here. So the speaker puts out the information, goes through the ear hook down into the ear mold. These are BTE hearing aids, behind the ear hearing aids, very common for the very elderly or children. And we'll talk about why that's the case in a bit. The battery, so these are all the sizes. So if you're seeing a patient in clinic and you're not sure what battery they use, you can ask the person or the parent and say, what color is it? And if they tell you the color, you know what size battery. So it's a 10, 13, 312, and 675. 675s are what cochlear implants use because they need a lot more power. Some of the really small hearing aids use a size 10. Most of them use a size 312 now. 10 isn't as common because they don't last very long, maybe like 5-6 days, whereas the 675 might last, a week and a half, 2 weeks, and they're usually around $1 a piece. Just to give you a frame of reference. Different types of hearing aid. Conventional behind the ear, which is what most kids wear. We'll go through that. Open fit behind the ear, which is newer. Mostly adults wear those. In the ear, in the canal, completely in the canal. They all look different. There's pros and cons to each. There's not one style for every person. Most kids obviously wear the behind the ear. People with very poor dexterity will wear the behind the ear. And essentially, you have the hearing aid hooked to an ear mold. When we have in class, I usually let you manipulate some of these and troubleshoot hearing aids, but since we're online, you're not going to be able to do that. And so BTEs are very well suited for young children. If their ear canal changes size and it gets bigger, you can replace it with like a $50 mold instead of a hearing aid that's thousands of dollars. So I usually say up until the age of about 15, 16, I like kids to wear behind the ear. And then after that, if they so choose and we work it out with the parents, they can use an in-ear. Here you go, cute little baby there. And you can see, you can get ear molds in lots of different colors, get hearing aids in lots of different colors, make it exciting for the kid. And again, here you have the ear mold in the ear. And again, these are inexpensive, so as they grow, like when they're little, if you fit somebody like at 3-4 months of age, you might be changing ear molds every 3 to 4 weeks. So obviously in-the-ear products are not appropriate for young children. The open fit BTE is just a behind-the-ear hearing aid that has an open fitting coupling. And so it allows the ear to breathe. And so people like them because they're small, they're comfortable, they let the ear open. And so here's a visual. This little tip goes down in the ear and it allows fresh air in there. It allows low frequency sounds to get in there if their hearing's pretty normal at that frequency, those frequencies. So, these are very comfortable. I sold a lot of them at my practice that I owned up until last year or this January. So they super popular, very comfortable, easy to deal with, and that sort of thing. This is just talking about the receiver in the canal, meaning that most of them have a speaker right here that goes down in the ear that's very close to the ear canal. There are a good bit of advantages to that. A lot of it's beyond what you need to know, but a receiver in the canal, if you hear somebody say that, basically they mean the speaker's down by the eardrum. And so those are good products. Okay. And again, there's a lot of advantages, even more so than this, but you can get a lot more volume because the speaker is right next to the eardrum. The in-the-ear, they're enclosed in a hard plastic shell. Some of the advantages is the natural microphone position, right? So this is where the sound enters, right? Well, the mic is very close to a natural position. These are the microphones. In a BTE, the microphones are up here, so they're in an unnatural location. So that's an advantage of these. That doesn't mean you use that because of this and say, well, even though they have bad dexterity, we want the microphone close to here. That's not a consideration, but that's just one of the benefits. Doesn't mean you don't use a behind-the-ear product when appropriate. This is a small benefit compared to a lot of the other things. In the canal, they're very small. They're somewhat cosmetically appealing. They can be out of sight. The advantages, cosmetics, microphone location, we just talked about that. The disadvantages is they're small. They're sometimes hard to manipulate. So again, the microphones on this one are here and here, and so they're right there. This is the microphones in the most natural place because the sound enters right here. The microphones are right here. Okay, these are in the canal, and they work well for a lot of people, but not people with poor dexterity or need a lot of boost. If you need a lot of boost, these are not for you. So the contralateral routing of signals, or the cross systems, essentially these are used when you have a normal hearing ear or close to normal hearing ear and a dead ear. Okay, so essentially it would be, oops, I shouldn't have moved that. It would be an audiogram that, sorry, I'm making a mistake here. So if you had an audiogram, you'd have one normal hearing ear, and then you would have essentially like a dead ear, no responses, okay? So this is when you use a contralateral routing of signals. And essentially what happens is it takes the information from the dead side. Okay, so the sound will come into the receiver. It's not a hearing aid on the dead side. It's not a hearing aid on this side. It's basically just a receiver. And then it's, so if this is a dead ear here, let me draw a little. So if this is a dead ear here, okay, person will have a receiver on this side and they'll have a microphone, so the sound will input here, but it'll transmit it over here. Okay, so if this is the dead side, this is that ear. It essentially transfers it to the better ear. And these work fairly well if the person gets it shortly after they have the hearing loss. But if it's a long time after the hearing loss, then it doesn't typically work. But that's a cross. Now a bicross is very similar. Sorry, I can't get this off here. A bicross is very similar, but let me draw this audiogram. So this you would have, a dead ear, so like a no response corner audiogram, something severe to profound. But in this case, you might have, in the best ear, you would have some degree of hearing loss. So in this case, you have, anybody guess? You have the transmitter, so if this is the dead side, you have the transmitter, but in this ear, you actually have a hearing aid. Right? The other one you didn't have a hearing aid because you didn't have hearing loss in that ear, but in this one, you have a hearing aid. So that's called a bicross. Okay? In that, you have a dead ear and an ear that needs a hearing aid. Okay? And they work pretty well too. Here's a picture. I guess I didn't need to draw that, but maybe I can get this off the screen. Yeah, here's the picture. So here you have the unaidable ear sending information to the hearing ear. Here you have the unaidable ear sending information to the ear that needs information from this side. But you also have a hearing aid on this side. Okay? That's a cross and a bicross. Okay? Some of the problems you run into with hearing aids, you have cerumen, moisture problems, always something. Sometimes the batteries go dead and you have to deal with troubleshooting. Kids love to lose their hearing aids and damage them. That's just something that you have to be very aware of. Candidacy for adults, it just depends. We look at a lot of things. We look at how much hearing loss they have, their dexterity, their motivation, all of those things. For children, it's a lot of, they don't get to pick. We provide them what they need, usually a BTE. We look at their hearing loss. Do they need a more powerful hearing aid and that sort of thing. Oops, sorry. Usually we get 2 hearing aids unless there's a reason we don't want to fit 2 hearing aids. That's very rare. So anybody that has a binaural hearing loss should be wearing 2 hearing aids, okay? 2 hearing aids provide good information that the superior olivary complex, the central system, can use to help them hear better in noise and localize sound better. And again, we talked about size of the hearing aid, that's cosmetic. How's their dexterity? Can they handle things? Can the parent handle things for the child? And so one way we validate hearing aids is to use some kind of scale like the COSI, the AFAB. The AFAB is posted. And really this is just to determine how well we're doing. Okay? Oops. So what I'm going to do is I'm going to stop the video. I'm going to do a quick one to finish up because we can only go up to 15 minutes. So I will post this and then there will be another one to finish up.